Hi, I'm Don Avery, the President and CEO of Fairview Park Hospital, and I wanted to take an opportunity to give the community an update on the hospital as it relates to COVID. Over the past few weeks, during the holidays and then the week following, we have seen a substantial increase in the number of patients at Fairview Park that are positive for the coronavirus. To give some examples of that, before Christmas, we probably had in the low 20s at any given time 20, 22, 24 patients who were positive for COVID. Over the past week and a half, we've been averaging in the mid to upper 30s and have even gone into the low to mid 40s on a couple of days. That's quite an increase. It's an increase of over 50% just in that time frame. We knew that there would be some increase probably following the holidays with people gathering and families getting together for holidays. It's been an increase that is certainly notable. The total number of patients in our county has increased to the point where we're a hotspot nationally on a per capita basis. We're in the top 10. Our ER has been very busy. For instance, right now at this moment, we have a 22-bed ER. We have 28 patients in the ER. 11 of those patients are waiting for a bed in the hospital. And of those 11, 6 of those are COVID positive, and they're included in our overall number. Right now, we have 40 COVID positive patients at the hospital. In that, there's some good news though too. Over the past several weeks and really over the past couple of months, the people who are getting COVID, their length of stay is shorter. They're not staying as long. Fewer people are going to the ICU. It used to be about 15% of the people that got admitted wound up in the ICU. And today that number is less than 10%. People are staying in the ICU for shorter periods of time, and fewer of those patients are being put on the ventilators. The numbers are rising. The people aren't quite as sick perhaps, but certainly we're very, very concerned about the number of people in the hospital. About half the people right now coming to our ER are COVID positive. We encourage people, if you do test positive, that doesn't mean you have to come to the emergency department. The majority of people can be cared for at home. If you look at the numbers that we've gotten from Dr. Kraft and the health department, the numbers of people that have COVID are significantly higher than those that are being admitted to the hospital. So most people can be treated and cared for at home, and we encourage you to start with that. Don't start by coming to the emergency department. At this point, our staff is handling it. They're busy and seeing a lot of patients. We are full, and yet with the turnover of patients, we're continually moving people in and out of the hospital. But it is, I would say, in the neighborhood of a crisis. It's a very busy time, and we encourage the community to continue using the precautions we've been talking about for the past year. Even those people who have got vaccines, like me, continue to wear your mask, continue to socially distance yourselves from others, minimize the number of social gatherings you go to, and if you do go to a social gathering, have distance from those around you, continue wearing your masks. And then one last thing, a lot of people have said they think the masks don't really help. The masks do help. The science is behind the mask. The science is behind the vaccine. I encourage you, when the vaccine becomes available, widespread to the public, to get the vaccine. It's also proven to do what it's supposed to do, and that is end this pandemic. So again, we're busy, we're taking care of people, we're meeting the needs of Dublin and Lawrence County, Middle Georgia, but we need the community to do their part as well. Thank you.